If your knee hurts every day, pay attention to this. Pain doesn't just make you suffer. It changes the way you walk, stand up, put weight on your leg, and even how much you trust it. You start to compensate. Maybe you've been living like this for months, maybe for years, and without even noticing, you've been reorganizing your life around this pain, taking the elevator instead of the stairs, skipping walks you used to enjoy, thinking twice before getting up from the couch. And the worst part is this: no one really explains why this keeps happening, let alone what can actually help in a simple and safe way. So today, I want to show you 5 exercises that can help your knee feel more supported, more stable, and less irritated in your daily life. And here's something important right away. The first one is the most important of all, because it works on a function that many people with knee pain lose over time. And that makes a real difference when it comes to walking, standing up, and moving with confidence. And stick with me until the end, because after these exercises, I'll show you a simple but very useful bonus that can help relieve the pain. But before we start the exercises, I need to tell you something important. This knee pain, this stiffness, this weakness, this insecurity, is not something you have to accept as normal. I know a lot of people hear things like, "It's just age, what do you expect?" Or, "Arthritis has no cure, you'll just have to live with it." But here's what physical therapy shows in practice every single day. Your knee doesn't hurt because you got older. Your knee hurts because the muscles around it have become weak, tight, or unbalanced. And then it starts working harder than it should, in the wrong positions, without the support it needs. And when you start giving your body the right stimulus, safely, at the right pace, it responds. It doesn't matter if you're 62, 70, or 78 years old. I'm not promising a miracle. I'm telling you what I see happening with real patients every week. Think of it this way. Your knee is like a door. If the hinges are well aligned and both sides of the wall are solid, the door opens and closes smoothly, without effort. But if one side of the wall is weak, or if the hinges are misaligned, the door starts to strain, creak, and wear down. And over time, it starts to hurt. That's exactly what happens to your knee when the muscles around it are weak or unbalanced. The body has an incredible ability to adapt. And what you're going to learn today is exactly how to activate that ability in a simple, safe way that you can do at home. Before we begin, tell me in the comments, how old are you? And which knee bothers you more, the right, the left, or both? I read every comment and love hearing how you're doing. And while you're at it, make sure to subscribe to the channel so you don't miss any videos. Now let's get to what really matters. Exercise 5. Lying quad set. And we begin lying down. It can be right on your own bed. No mat needed if you do not have one, no floor required. Just you, maybe a pillow under your head if you want, and 2 minutes of your time. What is this for in real life? This exercise activates the quadriceps, that muscle on the front of your thigh I mentioned, the main protector of your knee. But it does this without any movement. It is an isometric contraction. The muscle works internally, without you bending or straightening anything. That is why it is so safe, and also why it is so underrated. You know that feeling like your leg does not have enough strength to support you when you try to stand up? This exercise begins to change exactly that. How to do it? Lie on your back on the bed, legs straight, relaxed. Now take a rolled towel or a small pillow and place it under the knee you want to work, just enough to keep it slightly elevated. Slowly press the back of your knee down into the bed, as if you were trying to flatten your knee into the mattress. You will feel the muscle on the front of your thigh contract, tighten. That is exactly what we want. Hold for 5 seconds. Breathe normally. Slowly release. That is 1 repetition. Do 10 on each side. Common mistakes. The most common mistake is doing it too quickly and not holding the contraction. The benefit comes precisely from maintaining that pressure for a few seconds. No rush. Another mistake is holding your breath. Breathe calmly throughout the entire exercise. Adjustment if you feel discomfort. If you feel any discomfort in your knee while pressing, reduce the force. You do not need to push hard. A light contraction is already enough to activate the muscle. Over time, it gets easier. Quantity: 2 sets of 10 repetitions on each leg. Rest for 30 seconds between each set. If you are doing it every day, 1 round is already enough to get started. What matters most is consistency. A little every day is better than a lot once in a while. Progression if it feels easy. Hold the contraction for 10 seconds instead of 5. Simple. And it makes a huge difference. What you may notice afterward. After a few days, many people notice that their leg feels more stable when standing up, that the knee feels more in place. That is your quadriceps starting to do their job for real. Exercise 4. The bridge. Still lying on your bed or on whatever mat you have. The bridge works your glutes and hamstrings, the muscles on the back of your thighs and around your hips. And these muscles have everything to do with your knee, even if that does not seem obvious at first. What is this for in real life? When your glutes are weak, your knee starts to compensate. It takes on pressure it should not be taking, especially when you go up the stairs, walk on uneven ground, or simply stay on your feet for longer. Strengthening your glutes takes load off your knee. It is as simple as that. And there is more. Many people who do the bridge regularly also notice that their lower back feels better, because everything is connected. How to do it? Lie on your back on the bed. Bend both knees, keeping your feet flat on the bed, parallel and hip-width apart. Place your arms by your sides, relaxed. Now slowly squeeze your glutes, as if you were trying to bring your buttocks together, and lift your hips off the bed. Raise them until you form a straight line from your knees to your hips to your shoulders. Hold at the top for 2 seconds. Squeeze your glutes. Then slowly lower back down. With control, 1 vertebra at a time. That is 1 repetition. Common mistakes. The most common mistake is lifting too high, arching the lower back upward. That puts stress on the spine and takes the work away from the glutes. Lift only until your body forms a straight line, and stop there. Another mistake is coming down too quickly. The slow descent is where half the benefit happens. Do not throw that away. Adjustment if you feel discomfort. If you find it hard to lift both sides evenly, or if one side shakes more than the other, do not worry. Make the movement smaller. Just lift your hips a little. Over time, your body will build strength and balance. Progression if it feels easy. When it starts to feel easy, hold at the top for 5 seconds before coming back down. Or slow the movement down. 3 seconds up, 3 seconds down. You will feel your glutes working much more. Quantity: 2 sets of 12 repetitions. Rest for 30 seconds between each set. If your glutes feel tired the next day, great. That is a sign it is working. What you may notice afterward. After a few days, many people notice that climbing stairs feels a little easier, that the knee feels more stable while walking, that lower back pain decreases when getting up in the morning. It all starts here, with this simple movement, right on your own bed. Exercise 3, standing knee rotations. And this is the moment when we get out of bed and stand up. This is not a strength exercise, it is a mobility exercise. And I had to include it here because it is one of the most overlooked and one of the ones that makes the biggest difference in daily life. What is this for in real life? You know that stiffness you feel when you wake up in the morning? That feeling like your knee is locked, like it needs a little time to warm up before you can walk properly? This exercise gently mobilizes the knee, helps distribute synovial fluid, the joint's natural lubricant, and quickly reduces that stiffness. It is like oiling a rusty hinge before opening a door. After you do it, everything flows better. How to do it? Stand with your feet together or slightly apart. Place your hands on your knees, 1 hand on each knee. Slightly bend your knees as if you were doing a very small squat. Now make gentle circles with your knees. First clockwise, slowly, no rush. Then reverse, counterclockwise. The movement comes from the hips and knees together. Smooth, controlled, with no sudden movements. Common mistakes. The most common mistake is doing the movement too quickly, like a rushed stretch. The goal here is to mobilize, not to force. Go slowly and make each circle count. Another mistake is straightening the knees too much during the movement. Keep them slightly bent the whole time. Adjustment if you feel discomfort. If you feel dizzy or unsteady while standing, do the exercise near a wall with one hand supported. The important thing is to feel safe throughout the movement. Progression if it feels easy. Gradually increase the size of the circles. The larger the circle, the greater the joint mobilization, as long as it does not cause pain. Quantity: 10 circles clockwise and 10 circles counterclockwise. Do 2 rounds. This exercise can be done more than once a day, especially in the morning before you start walking. What you may notice afterward: many people notice that their first steps in the morning feel less stiff, that the knee feels looser, more fluid. That locked knee sensation starts to fade over time. It is small, it is simple, but it makes a real difference in your day. Exercise 2, partial chair squat. Exercise number 2, and this one is very special because it closely mimics one of the most important movements in your daily life: sitting down and standing up. It sounds simple, but it is one of the movements that most reflects a person's strength and independence. And it is one of the first to become difficult when the knee starts to hurt. What is this for in real life? Every time you get up from the couch, get out of a car, use the bathroom, or get out of bed, you are doing this movement. When the muscles that control it are weak, the knee ends up taking on a huge amount of pressure. How to do it? Grab a sturdy chair and place it behind you. Stand in front of it, or with your back to it, whichever you prefer. Keep your feet hip-width apart, toes slightly pointed outward. Slowly begin bending your knees as if you were about to sit down, but stop before you actually sit. Go only halfway down, or until your knees stay in line with your toes. Hold that position for 2 seconds, then slowly come back up, with control, pushing through your heels. That is 1 repetition. Common mistakes. The most common mistake is letting the knees cave inward, as if the thighs were collapsing toward each other. That increases pressure on the knee and can cause pain. Keep your knees aligned with your toes the entire time. Another common mistake is dropping too fast and using the chair to catch yourself. The chair is there only for safety, not for actually sitting down. The real work is in the controlled descent. And do not forget, keep your back straight. Do not round your lower back forward. Adjustment if you feel discomfort. If you feel pain when bending your knees, reduce the range of motion. Go down only a little, even if it is just 10 to 15 centimeters. Over time, your body will build strength and you will be able to go deeper without pain. If needed, place your hands on the back of a chair in front of you for support. Progression. If it feels easy. When it starts to feel easy, hold the bottom position for 5 seconds before coming back up. Or slow the movement down. 4 seconds going down, 4 seconds coming up. You will feel your legs working much more. Quantity: 2 sets of 10 repetitions. Rest for 45 seconds between each set. If your legs are shaking at the end, great. That is a sign that the right muscles are being activated. What you may notice afterward. After a few days, many people notice that getting up from the couch feels easier, that they no longer need as much momentum to stand up, that their legs feel stronger and more reliable. This is the exercise that brings training closest to real life, and that is why it is number 2 on our list. Exercise 1, isometric wall sit, mini squat. And now we get to exercise number 1, the most important on the list. If you can only do 1 exercise a day, make it this one. If you only have 2 minutes, spend them here. What is this for in real life? The isometric wall sit activates the quadriceps deeply, much more than most moving exercises. And it does this without impact, without excessive joint pressure, and without risk of falling. When the quadriceps is strong and active, it works like a shock absorber for the knee. It absorbs the impact of each step, stabilizes the joint, and reduces pressure on the cartilage. How to do it? Lean your back against a wall. Feet hip-width apart, slightly in front of your body. Slowly slide your back down the wall, bending your knees. Stop when your knees are around 90 degrees, or earlier if you feel discomfort. You don't need to reach 90 degrees at the beginning. Hold that position. Breathe. Keep your core slightly engaged. Keep your back against the wall the entire time. Knees aligned with your toes. Don't let them cave inward. Hold for 20 to 30 seconds, then slowly come back up. Rest. Repeat. Common mistakes. The most common mistake is letting the knees go too far past the toes. That increases pressure on the joint. Adjust your foot position. The further forward your feet are, the less pressure on your knees. Adjustment if you feel discomfort. If 90 degrees feels like too much, stay higher, with your knees only slightly bent. The exercise still works. The key is to feel your quadriceps activated. Progression if it feels easy. Start increasing the hold time. Begin with 20 seconds, then 30, then 45, then 1 minute. Once you can hold for a full minute with good form, you'll feel a huge difference in your knee strength and stability. Quantity: 3 sets of 20 to 30 seconds each. Rest 1 minute between sets. Do it every day. This is the only exercise on the list I recommend daily because isometric work doesn't create excessive fatigue and the benefits build with consistency. What you may notice afterward: in the first few days, thigh fatigue. That's good. In the first week, your knee starts to feel more stable when walking. In the second week, many people notice less pain when standing up. That the first steps in the morning feel easier. That confidence in the legs starts to come back. It's not as fast as a pill, but it's real. And it lasts. This exercise changes your knee from the inside out, strengthening what truly protects it. Now let's talk about a bonus tip that goes beyond exercise. Have you ever heard of turmeric? This yellow spice contains a compound called curcumin. And curcumin has anti-inflammatory effects backed by scientific research. Inflammation is one of the main causes of knee pain. And while the exercises work on strength and stability, turmeric works from the inside, helping reduce that inflammatory process. You can add it to juice, warm milk, rice, or soup. Just a pinch a day already helps. My patients love it, and whenever possible, combine it with a pinch of black pepper, because it boosts curcumin absorption in the body. Now, if you prefer convenience, it also comes in natural supplement form. Capsules, no taste, no hassle, the right dose every day. I've left an option I know and trust in the pinned comment of this video. Just scroll down and check it out. And that's it. 5 simple, safe, and effective exercises for your knee. From the easiest to the most important. You don't need to do everything perfectly right away. You don't need to feel results tomorrow morning. What you need is to start. 1 exercise, 1 day, and repeat. The body responds to consistency, not perfection. And if you do these exercises regularly and pay attention to how your body responds, many people notice real changes in days. Not months, days, more stability, less stiffness in the morning, more confidence with every step. That's priceless. But if your knee pain is persistent, if it comes with swelling, redness, or if it gets worse with movement, don't ignore it. See a doctor. These exercises help a lot, but they don't replace a medical evaluation when the pain may be signaling something more serious. Take care of yourself, and that includes seeking professional help when needed. Now tell me in the comments, which exercise are you starting today? Drop it below. I read every comment. And make sure to subscribe to the channel. Here you'll always find practical exercise videos to help you deal with pain. If this video helped you, share it with someone who also struggles with knee pain. A family member, a friend, someone you know needs this. See you in the next video. Take good care of yourself.